A coroner has returned a narrative verdict at the inquest into the death of a 23-year-old Waterford man who became ill and died 5 days after receiving the Janssen COVID-19 vaccine. Cork City Coroner Philip Common told the family of Roy Butler that on the balance of probabilities he could not conclude his death was caused by the vaccine.
Roy Butler was described by his family at the inquest into his death last month as a fit, healthy, sporty young man. His family told the coroner's court in Cork that after he got the Janssen COVID-19 vaccine, his health deteriorated rapidly. They described how he suffered convulsions at home and was rushed to University Hospital Waterford. He was then transferred to Cork University Hospital, where he died on August 17, 2021, 5 days after he'd got the COVID vaccine. Roy Butler's family believe his death was caused by the vaccine. They sought a verdict of misadventure. Senior executives of Johnson & Johnson insisted there was no medical evidence of a link between their vaccine and Roy Butler's death. They argued that a narrative verdict was the only appropriate one in this case. The Assistant State Pathologist, Dr. Margot Bolster, told the inquest Roy Butler had died of a spontaneous and unexplained intracranial hemorrhage, a catastrophic brain bleed. Dr. Bolster described Roy Butler's death as baffling and said that while a causal link between his death and the vaccine he received couldn't be established, it couldn't be ruled out either. This afternoon, Coroner Philip Common returned a narrative verdict saying on the balance of probabilities he couldn't conclude Roy Butler's death was caused by the vaccine. Roy Butler's family say they will now take time to consider the verdict and thanked family and friends for support. Coroner Philip Common also made a number of recommendations, including a request to health authorities here to consider an information campaign calling on the public to report adverse reactions to vaccines. Pascal Sheehy, RTE News, the Coroner's Court, Cork.